Today, we'll be gaining insight about MS, multiple sclerosis. We have Victoria, Brittany, Trish, and I who will be interviewing Marianne, who has multiple sclerosis for the last 9 years.
So Marianne, could you give us a little more insight on what MS is?
Yes, MS is a brain disease that affects the central nervous system. It can be diagnosed with an MRI and your physical symptoms. And on the MRI, it will show brain lesions, which is basically brain damage to different parts of your brain, the gray matter or the white matter.
Okay. What signs and symptoms did you experience that led you to seek help?
I started getting really tired at work, falling asleep, tripping. My right leg wouldn't go with me, muscle spasms in the bottom right part of my foot. I lost a bit of vision in one eye on a couple occasions. Pins and needles from your hands to your eyes to your feet. Pain. Patches of heat, they would just start in my leg and just turn like fire, or in my hip, or in my arm. There's so many symptoms, and they're different every hour even.
Did you have it for like quite a while before you decided to go and get it checked out, or?
No, I think I had it for about 8 months to a year previous, wow. And I didn't know what it was. So I went to a psychiatrist. My boss sends me to a psychiatrist. I think it's all in my head. Because, doctors are saying, well, we don't know, because they don't have a specific test for it until they do an MRI. Yeah. And I talked myself into getting one done at the time because SARS was on and nobody could get into the hospital. Mm-hmm. So I said, there's something wrong with my brain. Please do a CT scan, which is like an x-ray of your brain. And then they did the MRI and it showed 3 brain lesions, and that was in 2003.
Wow. What are some challenges that you face on a daily basis due to your condition?
Challenges. There's pain. There's physical symptoms like this morning I was slurring. It sounds like I've been drinking because the muscles in your throat and your mouth get weak, or in any part of your body for that matter. 1 minute I could be holding a glass of water, the next minute I can't hold that water. Or tripping, falling, can be anything. You just can't always see it. You actually have to live with a person to see what they really go through. Because people will look at me and go, wow, you look great. What's wrong with you?
You do. You look great.
I've had it for 10 years, but initially I couldn't get out of my bed for 1 year.
Oh, wow. Okay, so Marianne, from the challenges that you just discussed with us, what have you had to do to overcome them?
The most important factors are good nutrition, 10 to 12 hours sleep a day, and exercise. If I didn't exercise, I wouldn't be able to walk. That is probably the most important one. And I noticed that at the beginning because I couldn't do my routines at the gym. I couldn't do them at all. And then it was so painful to start them again, but I just kept going and going and going. And now I'm still going.
Awesome. From researching MS, we have learned that there are many treatments or medications that someone can use. For example, exercise therapy, massage therapy, corticosteroids, and immunosuppressants. What type of medication has worked best for you? Have you experienced any side effects from the medication?
Yes. Initially I was on a MS medication called Copaxone, which is a beta interferon, which is a synthetically made drug that resembles a natural protein in your body that your body makes, which protects you from viruses and your immune system to keep it strong. So if you don't have that, because that's what MS is also, it attacks your body, you get really sick and end up in the hospital, and then you have to go on steroids, which I was on for 3 months initially. Now I take this one. I just started this in December. It's called Avonex. It's kept in the fridge, and it costs $24,000 a year, so it's $2,000 a month.
Oh, wow.
And you can get it in a needle like you see in the hospital, but this is like a pen. So the medication is inside. This is the needle. It's about that long. And you attach it like that, and you put it into your leg once a week.
Do you do that yourself?
Yes.
Oh, I don't know if I can do that.
And is there side effects to that?
Yes. It feels like you have the flu, but times 100. It's very, very painful, and then you get really, really hot. And you just like feel like you have a temperature, and you usually get a temperature, and it lasts probably for like 48 hours. You
Oh,
can't
wow.
really do much. It makes you weak, and you feel like you have a really bad flu. And then it goes away until you take the next shot. But after about 4 or 5 months, they say the side effects improve. But I don't know that yet. We'll see.
Another question for you. Have you noticed any oral changes, physically or routinely, from prior to your diagnosis to now?
Well, because the muscles are affected, like my arms, like to hold my arms up, I cannot floss my teeth anymore. So I haven't done that in 10 years. I have to go and get it done. And I have noticed that my gums bleed once in a while, which they never used to either. So it's just more difficult to brush your teeth longer like you're supposed to. I don't know how many minutes that is,
Yeah.
but I do mine probably a little quicker
Mm-hmm.
because it's too hard to hold a toothbrush up for any length of time. So I use a lot of mouthwash to help kill the germs, I hope.
So have you had to modify your oral hygiene routines in any other way?
I would say, well, because I can't brush them as long, I use the mouthwash. Also, due to the fact that your blood pressure is affected by MS,
Okay.
and I take, it's called Omotec. It's a medication. It gives you that metal taste.
Oh, okay.
So you want to use Listerine or Scope or whatever to try and help with the metal taste of the medication. And same with this MS medication. It makes me really dry, thirsty. Now I haven't tried. I heard there's a new drug out for that for your mouth, but I don't know what it is. I saw it in a magazine or something. So I was going to look into that.
Yeah.
It makes you really thirsty too.
Now that you have this condition, can you rate the importance of good oral hygiene from a scale of 1 to 10? So 1 being very important to you and 10 being not so important.
Oh, I think 1 for sure. It's
Yeah.
very important to me.
Yeah.
I don't want to lose my teeth.
No, exactly. And over the years, what are some strategies that have helped you cope with your condition?
Being happy.
Yeah.
Exercising, enjoying every day. Because I know what it's like to be stuck in a bed and look at a ceiling for a year.
Right.
So I work on that, trying to take care of myself physically and mentally.
That's good.
And do you have any suggestions for a new kind of dental aid that would be useful for somebody that had MS that you would find maybe easier to use?
I would like something. I don't find anything that's strong enough for my teeth. Like I wouldn't want to have to run to the dentist all the time for the plaque and everything. So if they could come up with a better way of cleaning between your teeth without dental flossing, that would be a great idea.
Okay.
Something like that. Because I can't hold my arms up. So.
What do you find that your dental office does well when you have to go in for a cleaning?
I think they clean my teeth well, and they do floss them because they know I can. So
Yeah.
no, I think they do a pretty good job that way.
Okay. What do you find needs to be improved in a dental office setting for somebody that has MS?
I guess sometimes, like some people, there's different kinds of MS too. There's people in a wheelchair, and they don't have. I found in my office, they don't have the access for a wheelchair. So that should be important because you just don't know.
Right.
Some days I use a cane. Some days I can jog down the street.
Yeah.
It's hard to tell. So when you go into a dental office, if you can't get in, to the rooms where the chairs are, my dental office is not very wide. So, but I'm lucky I'm still, ambulatory.
Oh, yeah.
Wow.
So I don't know about all the other ones these days.
Okay, well, Thank you, Marianne,
Yes,
so
thank you
much.
so much.
for your time.
You're welcome.
Thank you.